Tony. I'm a level 1 nursing student. I'll be calling you today. Do you think you can give me an SR report on your patient?
Yep, this gentleman is Mr. Ryder Kind. He's in room 620. He's a male, 67 years of age. He has a weight of 171 pounds with a height of 5'11". He's a full code with no known allergies, and his admitting physician is Dr. Karen Phillips. He has an 1,800 calorie diet with 2-gram sodium restriction. He has a primary diagnosis of a stage 2 diabetic ulcer on the right heel with a secondary diagnosis of diabetes mellitus type 2 for 20 years now. He has a pain score of 1 with a steady gait and normal perla. His breath sounds are even, effortless, with lung sounds being clear on all lobes. There's no cough present, and the O2 stat is 95% room air. Heart sounds have no murmur and has a regular heart rate and rhythm. Bowel sounds are present in all 4 quadrants, and the abdomen is going to be soft, flat with no tenderness. No bowel movements and voiding issues are present. He has an output of 320 milliliters and is a self-voider. Vital signs were taken at 16:45, the heart rate being 76, the O2 sat being 96%, and the blood pressure of 128/70. The AccuCheck was collected at 16:45 with a score of 290, and that, according to the sliding scale, means 16 units. He does have an IV site in the right median forearm.
Why specifically is this client receiving this medication?
The client's receiving the regular insulin because the blood sugar is too high and the body can no longer produce insulin, so they need it from an external source.
What action does the medication have on the body?
It stimulates glucose uptake in the skeletal muscle and fat.
When should you question administering this medication?
You should question this administration if you were to take his blood sugar level, and the number would be within normal parameters.
Does the medication have a therapeutic serum level?
No.
Which vital signs must be monitored?
All vital signs are going to be monitored, especially the blood sugar.
Which physiological parameters should be monitored when the medication is being administered?
You're going to have look out for swelling, sweating, and any allergic reactions.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
He's going to be educated to alert us if he has any signs or symptoms of hypoglycemia.
What interventions must be taught for taking the medication safely at home?
We're going to educate him to rotate the sites in the injection sites once a week, and to choose a clean area and undergo safe injection practices.
What are the side effects and potential adverse reactions?
Some side effects include hypokalemia, dizziness, sweating, and being lightheaded. Some adverse reactions would be hypoglycemia and anaphylaxis shock.
How will you know the medication is effective?
We'll know that the medication is effective when we recheck his blood sugar levels and the number is within a normal range.
Okay, thank you.
All right, yep. All right, so we're just gonna come on into the room now. Knock, knock. I'm gonna wash my hands. Hello, Mr. Ryder Kind. My name is Trevor. I'm gonna be your nurse for today, and this is my student nurse, Tony. Can you tell me your name and date of birth?
Ryder Kind.
Okay. And your date of birth?
And date of birth is 10/16/1983.
All right. So, you are 67 years old?
Correct.
Very good. Very good. All right. So now we already washed our hands. We're here today because we're going to administer some insulin for you. Do you have any known allergies at all?
No, not that I know of.
Okay. So like I was saying before, we're here because earlier today we had taken your blood sugar and you received a score of 290. So according to the sliding scale, we need to give you 16 units of insulin. Is that okay?
Yes.
Okay, perfect. All right, so now I'm going to give you a brochure actually on any information that you may need. Any information, any questions you have. Do you have any questions for us while we're here?
No, not right now.
Okay. Here's that for you for future reference.
Thank you.
All right, so now I'm going to sign into my law. Okay. Okay. All right. So I'm going to ask you one more time. Can you please tell me your name and date of birth?
Ryder Kind, 10/16/1983.
Okay. And do you have any known allergies?
No, not that I know of.
Okay. I'm going to pull your medications now. All right. I have your medications here that I just pulled. I'm going to do my 5 rights. I'm going to make sure that this is the right medication, which it is. I'm going to make sure that it's the right dose, which it is, 16 units of regular insulin. It's going to be the right route, yes, the right time, 1700, yep. The right patient, yes. And what is your name and date of birth one more time?
It's Ryder Kind, 10/16/1983.
Okay, and the expiration date? The medication is has good clarity, expiration date's good. Okay, and I'm going to check those all with the MAR to make sure. Okay, all right, so once I do that, I'm going to scan my medications. All right, boop, boop, all right, very good. Now, I just scanned the medications, but in the event that the scanner doesn't work, I'm going to go ahead and type it in to my MAR here to verify with the green light. The patient ID. Sorry, I'm a slow typer. Okay, now the medication barcode D9, C9, C8, 7B, 0, BA. All right, now it's verified. Sorry for the wait there. So verified. We have the green light, so we're good to go. All right. So now, I'm going to actually refer to my drug book as well one last time. All right, now in case, we can always call the pharmacist and make sure that the medication is correct and everything's, so everything's verified. Do you see there?
Mm-hmm.
All right, so, very good, verified. I'm gonna put the drug book back. All right, so now, I'm going to, and we're going to bring the medications back up there. Okay. We actually ran out of gloves here. Our glove box is empty, so I'm going to go run and go get a glove box real quick. That box just had one glove left, so the night shift must have forgotten to restock. Okay, so I'm gonna wash my hands. Okay. I'm gonna put my gloves on. Good. Okay. So I'm gonna prepare my medications. I got my alcohol wipe here. Okay. While I'm doing that, I'm gonna check my 5 rights here. It's gonna be the right medication against the right dose. Throw that away. It's going to be the right dosage, the right route, the right time, 1700, the right patient. Mr. Can you tell me your name and date of birth?
Ryder Kind, 10/16/1983.
Okay, and do you have any known allergies?
No.
Okay. I'm going to check that against the MAR, and that is correct. All right, and there's no expiration dates. Good. The clarity. All right. Okay. So I'm going to uncap this here. I'm going to get about 16 units of air. Could you please confirm that there are 16 units of air?
Mm-hmm.
Okay. I'm going to insert. I'm going to make sure that I have 16 units. And can you please confirm that there are 16 units in that?
Mm-hmm.
Perfect. Now I'm going to use a very specific capping method. Okay, very good. Okay, perfect. All right, so now we're going to bring the medications over to the patient. All right, sir, we have the medications here ready for you. Can I ask you, during your last injection site, where was it exactly?
On the right abdomen.
The right abdomen. Is it okay if we do it on your left side now?
Yes.
Okay, and I'm going to confirm that it was on your right, which, yes, it is. Okay, so we're going to be doing it. I'm going to be doing it one more time. So I'm going to have my medications here. And just one last time, I'm going to make sure that we have the right medication, regular insulin, the right dosage, 16 units, the right route, we're going to do it on the right side, the right time, 1700, and the right patient. Can you tell me your name and date of birth?
It's Ryder Kind, 10/16/1983.
Okay, and do you have any allergies?
No.
You know, I'm gonna check that. And that is correct. Okay. So I'm going to get my alcohol wipe. Since you had stated that your last injection was on the right side, we're going to go ahead and do the left. We had already confirmed that.
Yes.
So the left lower quadrant here. Okay. Okay. All right, I'm gonna pinch the fat. Oh, you're gonna feel a little poke on 3. 1, 2, 3. All right. Now, did you have any? I'm gonna throw this in the sharps box immediately. Okay. Now, Mr. Kind, did you feel any unusual discomfort or pain in that process?
No.
Everything went smoothly?
Yes.
Okay, very good. I'm gonna take off my gloves real quick. And throw them away here. Okay. Now, can you teach back to me why, about your medication, why did I go ahead and administer that medication to you?
Because my blood sugar was too high.
Okay, and can you tell me what signs and symptoms you would experience in the future when your blood sugar is off balanced?
Sweatiness, dizziness.
Very good, very good. All right, do you have any questions about your medications I just gave you, or any other signs and symptoms that you have any questions for me at all, or concerns?
No, not right now.
Okay, I'm gonna go ahead and I'm gonna chart my information right here in the room. The administered. Yeah. Oh, it brought me back out. I'm gonna put that. Okay, so yeah, like I said, I'm gonna document the rest of my chartings while I'm in the room. The administered time was 1700. Right, and the administration notes and dosage. Patient client was given 16 units of regular insulin at 1700. Blood sugar levels were taken at 1645 with a score of 290. No signs of no complications were noted during administration. All right. All right, and I'm going to initial it. TS. And save. All right. I'm going to put the bed back down to how I found it. And sir, I'm going to put your call light within reach. Make sure that, you know, do my proper XYZs. Do you have any other questions at all, or anything I can do for you before I step out?
No, I'm okay, thank you.
Okay. I'm going to wash my hands. All right. Thank you very much, sir.
Thank you.
Okay.
Were there any pertinent pieces of information you reviewed before administering the client this medication?
Yes, we checked the blood sugar beforehand, and if the blood sugar was low, then I would not have given insulin.
Okay. Did this information affect your decision to administer the medication?
Yes, if the blood sugar was under 100, I would not have given it.
Okay. And did this information affect how you administer the medication?
Nope, it was still administered subcutaneously.
Okay. Thank you.
All right, thank you.